announce they're in trouble. Okay? So why don't we fix those first? And if the fix works for those folks, then apply it to the general population with the health care reform, rather than trying to do it all at once and we don't know if any of it's going to work then.
Okay,
Slow down is what I'm saying.
well, you know, you are absolutely right. And I have said repeatedly at my town hall meetings from back in July that I'm more interested in getting it done right than getting it done fast. There was a lot of pressure being placed to vote on this bill on the House floor before August. And I and many other members said, no, our constituents deserve to know more about what's in this bill. They deserve a chance to give us feedback about this bill, and then when we come back, we're going to have plenty of time to sort through all that, talk about what we've learned, and hopefully use that to make the bill better. I can tell you, the bill now, after we marked it up in 3 committees, is a lot better and a much better bill than the original draft bill that was introduced in June. And you folks helped make that happen. But let's talk about your specific concerns. You know, the VA healthcare system has changed dramatically from the post-Vietnam War era. And in fact, most medical economists and people who do surveys of patient satisfaction will tell you that right now the VA operates about as efficiently and with about the highest level of satisfaction, and in fact is on the cutting edge in many ways of healthcare reform. You hear a lot about electronic medical records as a way to improve access to patient records among physicians and also reducing medication errors. The VA has already implemented that system-wide and is getting very good results from it. So, you know, that's one government-run healthcare program that learned a lot from its mistakes and has become much more effective in how it delivers healthcare. We heard from veterans, we want more community-based healthcare. And right now in my district, I've got 4 community-based clinics, so my veterans don't always have to drive to Iowa City or drive to Des Moines, and my brother works at the VA hospital in Knoxville, which has been on a 10-year glide path to be shut down, and he's probably going to be working out of Des Moines next year. So what we've done in a lot of the stuff that we've been talking about is how do we learn from those programs that are getting it done right and providing efficiencies. And one of the things about Medicare is that despite all the problems, one of the things I hear at my town hall meetings is don't take away my Medicare. And in fact, one of my colleagues from New York introduced an amendment during the markup that said, this is it. The elimination of Medicare was the title of the amendment he introduced. And he had findings. Congress finds that Medicare is socialized medicine and Medicare is a single-payer system. And then in the body of the bill, he eliminated Medicare. And he did that for a very specific reason, to give people a chance if they really thought all government-run programs for health care were a bad idea. Now's your chance to go on record and vote that way. And nobody voted for the amendment. So, you know, I think that we're trying to do a lot of things, and you know, people will criticize you for that. But one of the things we know is that here's an AP story that this is from healthcare insurers. They expect next year that the cost of medical claims is going to rise 10.5%. We are on a pathway for healthcare costs that if we do nothing, we will soon be unable to afford healthcare. And even though people like the coverage they have, every year they pay more and more through their employer, or if they're self-employed, they can hardly afford it because right now the average individual plan costs about $15,000 a year. And so what we're trying to do is get our handle on this, learn from lessons that we have learned from in the past, and try to use the best practices to move in a new direction.
Thank you, Congressman. I think Tavis, you have a question here.